has been stopped, and we have commenced with the preparation for the relocation of the patients to appropriately equipped facilities. I shall elaborate on this recommendation later on in the statement. Recommendation number 2 was that the Premier of Gauteng Province must, in the light of the findings herein, consider the suitability of the MEC Ketane Mahlangu to continue in her current role as MEC for Health. As you know, this is no longer an issue. The MEC resigned the night before the report was released, and the Premier then appointed Dr. Gwen Ramokgopa as the new MEC, and she's here with me. She has been introduced to you. Recommendation number 3 is disciplinary proceedings must be instituted against Dr. Diego Ephraim Selebano, the head of the department, for gross misconduct and or incompetence. As you might have heard, in terms of the public service regulations, on the 8th of February, a precautionary suspension has been instituted on Dr. Selebano, and Dr. Ernest Kinoshi, the CEO of Steve Biko Academic Hospital, was appointed as the acting head of the department and is here with us. He has been introduced. Recommendation number 4, disciplinary proceedings must be instituted against Dr. Makabo Manamela, the Director of Mental Health in Gauteng, for gross misconduct and incompetence. The process has commenced, and a letter of intent for precautionary suspension has been sent to her in accordance with the rules. Recommendation number 5, the findings against Dr. Manamela and Dr. Selebano must be reported to their respective professional associations for remedial action with regard to professional and ethical conduct. In this case, a letter will be written to the Health Professions Council of South Africa regarding Dr. Bani Selebani, because he's registered with that council, and another will be sent to South African Nursing Council regarding Dr. Manamela, because she's registered with that council. Recommendation number 6, corrective disciplinary action must be taken against members of the Gauteng Department of Health, and these are 1 Chief Director, 5 Deputy Directors, 1 Chair of Mental Health Review Board, and a CEO and acting CEO of the Cullinan Care and Rehabilitation Center. Steps towards the process of corrective disciplinary action have already been commenced, and you will be told in due course where the steps are, but they have definitely commenced. Recommendation number 7 says all the remedial actions recommended above, that means 1 to 6, must be instituted within 45 days and progress be reported to the Chief Executive Officer of the Office of Health and Compliance within 90 days. As I've already reported, you heard that recommend 1 to 6 above. We have already commenced. We did not even wait for the 45 days, and we believe we are on course for the progress within 90 days. Recommendation number 8, the ombud fully support the ongoing SAPS and forensic investigations underway. The findings and outcome of this investigation must be shared with appropriate agencies so that appropriate action, where deemed justified, can be taken. SAPS, the South African Police Services, has started this work as early as September 2016 with forensic investigations and the processes to help identify some of the bodies not yet claimed by relatives. At the moment, I'm aware that they are busy with identification and postmortems on at least 19 bodies that have not yet been claimed by relatives. Our understanding, ladies and gentlemen, of the ombud's recommendation that these findings be shared with appropriate agencies is that structures like the prosecuting authority will have to step in to determine whether there's any criminality or otherwise to be prosecuted upon, and we shall leave these jobs to them. For us, we are cooperating with the police in this regard and will furnish them with whatever information and grant them whatever access whenever needed. Number 9, the National Minister of Health should request the South African Human Rights Commission to undertake a systematic review actually of the human rights compliance and possible violations nationally related to the mental health. This has been done, I've written the letter to the Human Rights Commission to start with their systemic and systematic review, and I've written that letter last week. Recommendation number 10, appropriate legal proceedings should be instituted or administrative action taken against the NGOs that were found to have been operating unlawful where mental health care users died. We were waiting for the technical teams of experts to visit these NGOs first and advise on the appropriate legal and administrative steps. These visits have been completed, as I'll report below. Recommendation number 11. In the light of the findings in the report, the National Department of Health must review all 27 NGOs involved in the Gauteng Marathon project that do not meet care standard, and those that do not meet the care standard should be deregistered, closed down, and their licenses revoked in compliance with the law. This recommendation, ladies and gentlemen, will be read together with recommendation number 13. Just to remind you, recommendation number 13 says all patients from live Esidimeni currently placed in unlawful NGOs must be urgently removed and placed in appropriate health establishment within the province where competencies to take care of their specialized needs are constantly available. This must be done within 45 days to reduce the risk and save lives. Simultaneously, a full assessment and costing must be undertaken. Taking these two recommendations together, number 11 and number 12, I've got this to report. On the 4th of February, I appointed 60 professional and technical experts, mainly in 6 disciplines. The first discipline was psychiatry, second one, psychology, the third one, social work, the fourth one, occupational therapy, the fifth one, psychiatric nurse, and the sixth one, environmental health inspectors. From the 6th to the 9th of February, that means over a period of 3 days, 27 NGOs with a total of 42 facilities have been visited by these 60 experts. To date, we can confirm that 7 facilities have been closed and no longer house any mental health patients. Please note that the closure started as early as October last year, when the Ministerial Advisory Committee on Mental Health, headed by Professor Solira Taimani from Sefako Makhatu Health Sciences University, visited 17 out of the 20 facilities ahead of the ombudsman's investigation. And since that time, the closures have been taking place. I'm saying this because there is a perception that the closures only started with the ombudsperson, but they actually started before that. The closed facilities are as follows: 2 facilities under the NGO called Precious Angels, one in Atteridgeville and the other in Danville, Pretoria West. 2 NGOs which are operating the Cullinan Care and Rehabilitation Center. They are named eNCA and Siabadinga. 2 facilities under an NGO called Rebafeni in Erasmia and in Pelindaba. 1 NGO called Bophelong Mashimu in Hammanskraal. Since the closure of the Life Esidimeni and the closure of these facilities I've mentioned, mental health patients were transferred to 10 hospitals within the province. As it is, 600 mental health patients are under supervised medical care in these hospitals. The remaining 22 NGOs that were housing patients from Life Esidimeni have been assessed last week, as I've said, within that period of between the 6th and the 9th, and the recommendations from the task teams is that they will be closed immediately. I'm unable to announce their names. I've got them here, but I'm unable to announce them because we only received the report from the professionals and the technical experts last night. and these NGOs still have to be finally informed of their status by the relevant authorities. But to ensure the safety of mental health users, taking into account the concerns of the family, because, ladies and gentlemen, in everything we've been doing up to so far, we've been meeting with the families. We have not been doing anything alone, because we want to know what is that which the families prefer in trying to de-establish this project. And so, taking into account the concerns of the families and the medical condition and status of the patient, the transfers out of NGOs and into care facilities will be systematic, will not be rushed, and planning will be meticulous. This, by the way, is the recommendation of the experts. The interest of mental health users is of paramount importance, and we dare not repeat the deadly mistakes of a hurried, chaotic, and hush-hush job, as it has happened and led to this tragedy. So in our desire to reverse the tragedy, we were warned not to be overzealous and repeat the same mistake. So we'll follow a very systematic and well-planned, meticulous program. To this end, teams have also visited and assessed facilities that will be receiving the transferred mental health users. The facilities visited are both public and private. That means they've all been inspected for compliance. I need to mention this fact because there is also a narrative that we don't want to use private healthcare facilities, despite the fact that we have mentioned many times that we would like to. The private hospitals have been phoned over the past 2 weeks, and many of them clearly don't have any facilities whatsoever for mental health users. They do have beds, yes, but mental health users don't only need beds, they need something more than that, which is the first reason why the NGOs could not be able to handle them. And most of the mainstream private hospitals clearly told us that they are not in a position to help, but those which are like Esidimeni, which could be of help, have actually been visited and assessed. And I have to mention further, ladies and gentlemen, that contrary to popular sentiment, that we can just close this project by sending patient back to Life Esidimeni. Even Life Esidimeni is no longer immediately available to accept this patient, because for a period of 9 months, they established their operations and they need time to prepare these facilities to their former condition. I've been in contact with the CEO of Life Health for the whole of this morning to discuss their state of readiness. And they believe they can only be able to take 75 patients within a week. The rest, they will need at least 8 weeks for preparation. Apart from Life Esidimeni, another private sector facility which has been visited and inspected is the former step-down facility in Selby, which has also been closed down by the provincial department some times back. This facility was not a mental health facility, but it was a step-down facility for Chris Hani Baragwanath Hospital and Charlotte Maxeke. It was subsequently closed. We have visited it to ask the owners if there's a possibility that they can get ready, but they need a lot of preparations because they were housing patients which were not mentally ill, and the facility was then different from what facilities that must house mentally ill patients. But we believe we'll be able to meet the ombud's deadline of 45 days. The transfers will be supervised by the professional and technical teams, as it should have been the case even before the Gauteng Marathon project started. I am emphasizing this, ladies and gentlemen, because there is also a perception that there was no plan in terms of deinstitutionalization of mental health patients from both the country and the World Health Organization. There was a plan, and supervision by professionals and technical teams is a prerequisite for that plan. And this is not what happened when Gauteng Marathon Project was undertaken. That's why the ombudsperson clearly mentioned in the report that the department did not follow the plan. They misinterpreted it and misrepresented it, as he said. So we're just saying what we are doing now is just to follow the plan, which originally should have been followed by getting guidance from professionals who must assess each and every patient. These professionals, when they visited the facilities, which at the moment have close to 700 patients, not 1,300 as it was said, have actually examined physically and medically most of them. But I also want to emphasize that families will always be part of the decision making in the actual process of the transfer. In other words, when the professionals and technical teams assess each and every patient and take a decision, they will not do so alone. Families will always be at hand to give their inputs and their approval and their consent if necessary, this also being what should have happened originally. Recommendation 12, 14, 15, 16, 17, and 18 are work in progress and will be reported on in due course. These are recommendations about changing some of the acts, about meeting the families for a closure, etc., etc. The recommendations to the Gauteng Department of Health, which I said are 6 in number, most of them are medium to long term and are about the systemic improvement of the healthcare system. The new MEC, Dr. Gwen Ramogopa, is already busy with them. Recommendation number 1 under Gauteng Department of Health is actually being done at the national level. This is the recommendation whereby the ombud was very unhappy about the lack of data and in terms of numbers of who we are dealing with, as you heard, many numbers were bandied around. That recommendations that say the development of information systems with the patient registers and database by which to make evidence-based decisions, monitor and evaluate health care delivery must be a priority for the Gauteng Department of Health, and this recommendation is strongly endorsed by State South Africa. I just want to report to you that this recommendation is actually being done at the national level. We have actually started about 18 months ago. It is called a unique patient identifier. It's a system to identify all the patients for the whole country. We have been working with CSIR, the Center for Scientific and Industrial Research, the Department of Science and Technology, and the Department of Home Affairs. At the moment, 1,650 healthcare facilities at primary healthcare level have been completed, and we have already commenced with others. We believe by the end of this financial year, we'll have completed 1,800 facilities, and we have already also commenced the work in hospitals in this regard. I can confirm to you that 4.7 million South Africans have already been registered on this system. We believe by the end of the financial year, we'll have registered 7 million people on this system. And so it's not a system for Gauteng alone. By the way, this work is also in preparation for the national health insurance, because every South African needs to be registered and have a unique identifier in this system. Thank you very much.
Okay, thank you, Minister. We'll now take questions. And we'll do one question at a time. So don't ask 5 questions. Then you can come and have another round after your first question has been answered. Yeah, we can start with you here. Just identify yourself. Yes. There.
This is on Venter from Rapport. I want to know about the NGOs. Do you have a final list and number of NGOs involved? Because I was told by the department at some stage that there's about 122 NGOs. Then the ombud was told about 50 NGOs, and then finally he looked at 27. So how are we going to determine what's the real number of NGOs and who they are?
Okay, I think the report is very clear and specific on that matter, but the minister will answer, and the MEC, if she wants to add, she can do.
Catherine, what I said was this. The team visited the 27 NGOs, which encompass 50 facilities, which have got patients within them. But the teams also visited other healthcare facilities, public or private, including Life Esidimeni, with a view to taking some of the patients there. And indeed, there are already 600 patients under supervised medical care within the country. 206 are in Vescopis, as you are aware. It's a well-known mental health facility. 202 are in Kalinen Mental Care and Rehabilitation Center. 73 are in Sterkfontein, as you know, is a well-known mental care facility. Others are in hospitals like Alafon, Lerato, Puluso, Mamelodi, Pretoria West, Jubilee, Tshwane District 10, and Tulenesia Community Health Care Center. Now, these are public health facilities, but now the experts also visited other facilities which are in the private sector, and that includes Life Esidimeni. It includes Selby, which is a former step-down facility. It was a step-down facility for patients who were recuperating from Chris Hani Baragwanath Hospital and Charlotte Maxeke. Mostly medical and surgical patients, not mental health, but it has been assessed to see whether it can be used. Now, when we start transferring patients, we are going to listen to these experts. They are going to tell us how many do they think each facility must take, whether life is demanding or not. We won't necessarily listen to the facilities themselves when they said, I can accommodate so many, because that is in the first place which caused this disaster, where some NGOs took more people than they can. So we are not going to pretend that even the other facilities that are not NGOs are in a position where they could be fair to us or honest and take whatever they can. We want the experts to assess and say, here you can put 10 patients, here you can put only 5, etc., etc. Because, needless to say, without speaking ill of them, quite a number of them are in business and they would like to get as many or as much as they can. So we are going to depend on the expert. My discussion with Dr. Andre Meyer, the CEO of Live Health, was about their state of readiness. How ready can they be and for how many patients? Obviously, he'll give me his own figures. Like he said, 75 can be taken immediately this week. But our experts will have to satisfy themselves first and say, yes, indeed, we agree with Esidimeni that the 75 patients can be relocated back. They are the ones, Esidimeni, who told us that they can't take everybody back within a short space of time. They need something like 8 weeks because, as I've already mentioned, they de-established their operations over the 9 months that there were no operations there. For instance, some of the workers went away. The operations that they've been putting, that has been running continuously were de-established and they need time to re-establish them. But if they tell us that they are ready, the experts, this team of 60 experts, still have to give a go-ahead. So we are going to be guided by them quite a lot. Thank you.
Right? Yeah. Let's take it there.
Prashant Pillay from Africa Daily. I just want to carry on with the NGOs. I've spoken to a few of them. They seem to have been visited by the experts and the groups from the department, but they don't seem to have any indication of what's going to happen, when patients will be transferred, what's going to happen to them. They basically left in the dark. Some of them that I spoke to, I can mention the names: Saint Michel, Shama House. Are actually non-profit organizations living off churches. They're not businesses, but they actually don't know what's going to happen. Is government going to talk to these people to say what's going to happen? Just as much as that, is government? The president said in his State of the Nation address that government promises commitment to the families. I know, Minister, you said this is work in progress, but what's been happening? I know there's been meetings with MEC Ramakgopa with the families, but just what is the progress of that?
Yes, firstly, the NGOs will be informed if anything is to happen. The task team visited to make assessment and review in line with the recommendation of the whole health ombuds. And they have to give recommendations back to us. The teams cannot arrive there and make laws and all that. They are technical experts and professionals. Their job is to say, come and say, Minister, on this NGO, these are our findings, this is our recommendation. It's up to us to decide whether we want to listen or not. But I'm just informing you that we are going to listen to them as much as possible. Now, once we have taken such a decision, after we have listened to them, the NGO will be informed. I told you they have already told us 22, which they recommend must be closed. And I decline to give you the names. I've got them here. But exactly because they've not yet been informed. No, I won't. That affiliate, don't take chances. Yes, I won't. Because it's just fair. And NGOs are not closed because they are making any money or not. This whole thing is about safety and security of patients. Even if the NGO is not profit-making, if it is found that there is one way in which the task teams are not ready. Remember, I told you these are 6 disciplines. We have got psychiatrists who will determine this, the mental status of each and every patient and tell you that, look, in terms of my understanding of psychiatry, a patient of this nature cannot be accommodated in such and such a facility and give reasons. We have got psychologists, we have got social workers, we have got occupational therapists, we have got psychiatric nurses, and we have got environmental care inspectors who might even come and say everything else is okay, but in terms of the environment here, and give reasons why they think it's not appropriate. So that's why the NGOs will be told. So the closure in some of them is not going to be a process of punishment or not. It's just that the mental health patient must take priority over everybody else because they have suffered really. And we don't want to repeat that type of suffering. We are all pained and distressed by what happened to them, and so it won't be wise for us to do business as usual and behave as if nothing has happened. So to this end, I've said, even facilities that were operating before Life Esidimeni project, if they are found in one way or the other not to be adequate, they will be so informed. But remember, with the ones that were housing Life Esidimeni patients, the ombudsperson said, we need to de-establish these patients, mean they must all be taken away. And so we are actually following that. So, Dr. Pile, you are also asking about families. I have met the families with Premier Makura, rather the representative of the families with Premier Makura on the 5th of February. One of the things they told us, because there were already lots of statements in the media that we need a national day of mourning, a national day of prayer, the flag must be at half-mast, etc. The families pleaded with us that please don't do anything until we hear from us, because we are afraid that if you just start doing all those things, we'll actually soon be forgotten. It will be a battle of powerful people fighting for power, for power and superiority, or scoring political points whatsoever, and we will be forgotten. They said, please concentrate on our plight. As it is at the moment, we have got immediate needs, and our plight is that we still have patients in these NGOs. Some people have not yet been found and identified. That's what we want you to concentrate on, and that's what we've been doing. We then agreed that we are going to meet them on the 18th with the Premier in terms of recommendation. I think it's in line with recommendation number 17, yes. We are going to meet with them, for them just to sit with us and open their hearts and tell us what they've gone through. This is a process of healing according to the 17th. According to recommendation number 17. So that meeting is only going to be on the 18th, where the families will be brought together, and we'll sit and listen to them, and they will also tell us what their needs are and what they want us to do. This issue of whether there must be a national day of prayer, whether they said, please hear from us. Don't be ahead of yourselves, because it might be good for you as leaders or as political parties, etc., but not necessarily good for us. So we are definitely going to listen. And in that meeting, we will then develop a program to meet each and every family, to ask them one question. When you say there's closure in this project, what will that be? Because it will be different for families. That means each family must tell us. For them to say yes, of course, the person who is departed cannot be brought back. That's very clear. Of course, that person can be brought back, but for us as a family to say there's been closure and justice, this is what we'd like to see. We'll listen to that, and as you know, the recommendation further said a credible, prominent South African with an established track record shall lead such a process. We are still going to decide who is that credible and prominent South African. We more or less have ideas with Premier Makura, but as in line with the families, we are not going to announce and say we think so and so is a credible and prominent South African. We'll propose to them and see if they accept. So whoever person is eventually chosen, it will be in agreement. That means myself, Premier Makura, as the recommendation saying, together with the families, will agree on such a name. Any name that is not agreed upon, we're not going to push it down the throats of these families. So the meeting on the 18th is going to be very essential to start such a process. That appeal. Thank you.
Do we have any more questions? Don't see a hand. No one in Cape Town. I think that will be the last. Thanks.
Catherine, put the mic on.
Sorry. This was just a question from some of the families I spoke to today. You did say you were meeting with them on the 18th, but they were a little bit concerned you were meeting with the media first, and they didn't know that any of the NGOs are going to be shut down. I mean, do you feel like you're consulting properly if they don't know yet that the NGOs are going to be shut down and they're hearing it through the media?
Well, I never named the NGO. I've just said we're going to. And as far as I'm concerned, I'm surprised because, look, I'm not going to lie to you, Catherine, and said we have met 600 or 700 families who are meeting their representative. And the task team has been meeting with them, together with Section 27 and South African Depression Anxiety Group, SADAG, and Christine Mumalo, who has been representing families. We haven't done anything without their knowledge. If unfortunate, and they too did not hide the fact that they might not reach to all families. They didn't. Section 27 clearly said it. That's why they made a proposal of each and every family member having, they used a term, a sort of a mentor who will represent the interest of each. Because they said they don't have capacity to conduct each and every one. So we might, as part of that process, choose a particular person who, on everyday basis, will represent the interest of each and every patient. So I am not going to blame them and said, no, but this is what we told them. But they are aware. They were aware of these visits. They were aware of the purposes of the visits. And they are aware of the recommendation from the ombud that says some NGOs must be closed. It's one of the recommendations, and it's not the choice of families. Their choice is how and when and what do you do to their relative. Their choice is not whether the NGO must go on or not, because then it will confuse the recommendations of the ombuds for each one, whether us as government families to say, oh, recommendation one we take, no, that one we don't accept. No, this one we take, that one we don't accept. Their concerns, which I've heard, Catherine, is that they believe that this constant removal of patients is disturbing some of them. And that's why we said we'll do it meticulously. They told us that some of their relatives actually are scared of being removed again. And you can understand part of the fear. The way they were removed from life Esidimeni, you remember the manner in which the ombuds person characterized it, that it was chaotic, it was rushed. He even used a very strong term and say like cattle in an auction. Now, if you are a relative for a patient and they talk about closure and removal, that may come to your mind immediately and you may say, no, please don't do it. Not realizing that in this case, this is a completely different, well-planned process led by experts who actually understand and know what they are doing. But as I'm saying, each and every step we will consult the relatives. And that's why I'm not giving you the names of these NGOs. But we're not going to get permission first from the families whether an NGO will be closed or not, because it's a recommendation of the ombudsperson. He might be closing it not for that family, but for future families which might inadvertently end up there and be in trouble. So they must understand that this is an overall project of making sure that mental health users are safe. Remember, it doesn't end here. The Human Rights Commission is also going to undertake what the recommendation called a systemic and systematic review, which means they are going to review all areas, whether public or private, nationally, which are not necessarily part of this life is Esidimeni, just to see whether things are going well. And they may come with other recommendations too, and they may include social development department, health department, or any other which has got people who are using mental health. Thank you.
Minister, can I just add?
Yes. Sit here.
Thank you very much, Catherine. I just want to also add that as it Mr. Pillay has also said, that I did meet the families as well. And what we were also meeting them with the Department of Social Development. To the best of my knowledge, there is a process that began on Monday to visit each and every family to advise them of the developments since the Ombuds report, if they have not as yet received, because we also know that the Office of the Ombuds has been in touch with the patients and stakeholders, and also to advise them of the recommendation of the family committee, family representative committee, on this healing session, and to invite them to also participate in the healing session.
On the 18th.
So, yes, on the 18th. So there is a process of the social workers and the Department of Social Development, and in that healing session, there will still be all these experts as well to support the families and to ensure that the families, are fully involved. I think the minister did say that even in the visits to these facilities, families have been participating. Thank you.
Okay. Last, yeah.
Sorry, I just have
Many last now.
one question.
Not that
A big problem was the funding of the NGOs. When I started writing about it in June last year, and none of them got funding then. So, are you sure now? When did they start getting funding? And I mean, that's got a huge influence on them being able to do their jobs and being able to cope with the patients. Are they getting funding now? Are you taking that into regard?
Well, unfortunately, Suzanne, while the ombuds person was painfully aware that some NGOs were not giving any funding, and that's why they couldn't buy food, that's why people died of dehydration, etc. Whereas he's aware, but his recommendations are not stating anything on what you say, that if some NGOs are giving money, then they'll suddenly improve. It's not part of our brief. And most certainly, if an NGO believe they can reapply for a license, then they must make improvements and apply, and they'll be visited accordingly, because there are criteria which unfortunately were not followed by the Director of Mental Health in Gauteng when offering these licenses. Remember, the Ombud said she was just dishing them out. There were no criteria. Now criteria needs to be followed. I can give an example of the Health Professions Council of South Africa. When they go to a hospital to assess it, whether it can be accredited for training of internship. They tell them of all the shortcomings and say, we won't allow you to take interns this year unless you correct these shortcomings. If the hospital is able to correct them within a reasonable time, then they will correct and call them back. Then they will assess and give them a green light. So the NGOs are not bad, but for them to say they need money first from the state in order to be in a good state of health, I think it was not our brief, and we are not going to follow that particular line of reasoning, unfortunately. But remember, it does not mean that all 27 of them might not have been good. It simply means they just were unlucky by being issued a license by a wrong person. Those have been identified by the experts, and one of their recommendations is that the new HOD, Dr. Kinosi here, and he knows, perhaps must correct that, because all that needs to be corrected is a wrong person issued the license. That makes it invalid. But every other thing is in place. So all you have to do is to validate the license and issue it normally. But it's not all the NGOs which will meet the standards. Others received an invalid license from a wrong person, but they were also not meeting the standards anyway. And so in that regard, we'll tell them that they can't operate. But if within a week, they are able to correct and call Dr. Kinosi back to come and apply the standards and issue them with a license, so that will happen. That will happen.
Okay. This brings us to the end. Thank you very much, ladies and gentlemen. Obviously, we are available on phone if you have any further inquiries about this matter. Thank you.